Alrighty, girl. So let's talk about yeast infections. If you're a woman, you've probably had a yeast infection. If you haven't had a yeast infection, you'll probably get one before you kick the bucket. 3 out of 4 women get a yeast infection before they go to the other side. A yeast infection is a fungus called Candida. It's an overgrowth of that fungus in your vagina. Now, a yeast infection can happen anywhere on your body, but today we're going to be talking about yeast infections vaginally. So a vaginal yeast infection. I think one common misconception about yeast infections that we should talk about is people saying that it's an STI. A yeast infection is not an STI, and actually you can get yeast infections from practically anything, unfortunately. Vaginas are very sensitive. You can change your soap and you can get a yeast infection. You can leave your swimsuit on for too long in the summer and you could get a yeast infection. If your partner, however, did use something on their private area that doesn't agree with your body and then you did the do, yeah, you could get a yeast infection from that, but it's not an STI. Some other factors that make you at risk for having a yeast infection are after you finish a round of antibiotics, it's very common to get a yeast infection. Birth control pills are very common for, the cause of yeast infections. Being pregnant can cause, yeast infections. Now, of course, you should always get a doctor's opinion. You should always go to a healthcare provider. But here are some of the symptoms of a yeast infection. If you have consistent itchiness that just will not go away, if you have pain when you pee, if you have cottage cheese discharge, it literally looks like cottage cheese in your underwear. If you have swelling around your vulva, those are all yeast infections. Not yeast infections. Those are all symptoms of a yeast infection. Now, I will say that I just lost my train of thought, so give me a moment. All right. Yeast infections do not have a strong odor per se. If you have a strong odor, that could be bacteria vaginosis, which I'll make a video about as well. Yeast infections do have a smell. It's just not very strong. There are many over-the-counter medicines and treatments for yeast infections. Your doctor can also prescribe a medicine for yeast infections like a cream, or you can take one pill. I think it's called fluconazole. However, those have never worked for me. If you've had a yeast infection and you've taken over-the-counter medicine and it has continuously come back, you know the struggle. You understand it. There are several natural remedies that you can find online, but the one thing that has worked for me, because I used to suffer from chronic yeast infections, the slightest thing would throw me off. But I did start using boric acid suppositories. They have been a complete game changer for me. And I actually started making my own, and I'm very excited to share it with women. If you don't know me, my name's Morgan. I have a feminine care line called Flora. I create supplements and other things for women who experience PMDD and overall women's health. I am building a community for women. So if you want to join my community, you can follow the link in my website, or if you want to order some boric acid suppositories. And I also make a supplement for women who experience PMDD. You can look at my other videos and find more information about that. Peace.